Welcome back. We're still talking obstetric fistulas. Now, you can call in at this time. The number to call is 0808-054-2233. That's 0808-054-2233. And you can tweet at CTV_Mary A while we continue with the questions. Now, I want to ask you, Faith, you've met some people with obstetric fistulas. What was your impression of them? How did they feel? Did some of them, did most of them not know that there was something that could be done about their situation?
My first contact with fistula patients was in Niger Republic in 2013. The patients do not realize that they can be fixed. There was a patient I met who had lived with fistula for 25 years. She had a daughter who was 21 who also had a fistula. They had no idea that it could be repaired. A fistula patient tends to be somebody who is very psychologically affected because of the stigmatization and the rejection which Dr. Lawal described earlier on. So my biggest support area for them as patients, as individuals, is letting them know that they count. Letting them know that, because they haven't been touched for a long time, nobody wants to keep a fistula patient near them because there's a hovering smell of urine or feces all the time. So what I tend to do is make sure that I reassure them, I give them lots of hugs.
But concerning this smell, I mean, can't they just have a bath maybe a bit more often and be okay?
It's very interesting what you say. As you know, we just ran 2 programs, one in UCH in Ibadan, another one in Bida in Niger State. And there were marked differences. When I walked into the fistula ward in UCH, I started engaging with the patients. And it was only about 20 minutes later I thought, wait a minute, I'm in a fistula ward, but there's no smell. In the South, that is my experience, the women take more care of themselves. A fistula patient will wash herself 3 or 4 times a day, get perfume, change her clothes as much as she can so that she can still engage in normal life. So you find a woman who has fistula going to the market and selling her wares and nobody realizes because she's not spending. When I went to the hospital in Bida, the minute you walked in, you knew you were in a fistula ward. So a lot of it depends also on perhaps the resources people have access to. One of the points which...
But would you also say it's partly cultural, that people feel more accepted in the South, maybe more enlightened?
I don't know if I'll say more accepted or perhaps more enlightened. Perhaps more enlightened would be the word.
Okay, now I want to ask you, doctor, after a person has had a fistula surgery, you expect to send her home and let her continue with her merry life and everything, but you get repeated cases. Is there a point where a woman cannot be repaired anymore? 3, 4 times she's being repaired. Does it have consequences for her tissues in her body?
Yes, it actually does. We usually, when a woman has an obstetric fistula, we usually look forward to the first repair, because with the first repair you have a better chance of achieving success with closure. Okay, but in some cases they could be complex, because one case is different from the other case. So in some cases where you have a complex fistula, it might take 1, 2 or 3 repairs to finally achieve closure. But as much as possible, we want to be optimistic, such that we try as much as possible to make sure that every woman achieves closure at one point or the other. So it might take a longer time, might take a shorter while to achieve that closure, but we want every woman to achieve closure. Despite that, there are some fistula cases that might be irreparable, when the damage is extensive and there's total loss of what you are even going to use to repair. But with that too, you can also do some other advanced surgeries.
Okay, so at this point, prevention becomes key.
Prevention
is this thing totally preventable?
It is totally preventable.
100%.
100%.
But that means, it's not only one person that comes and forms a fistula. 2 people come together to do this. What do you do with the husbands?
Typically, as I think the doctor had referred to earlier on, typically a husband will reject his wife, when she has a fistula. We have, however, many very inspiring stories of husbands who support their wives through the process. It is true, it takes 2 people to have a baby. And this is something which is very important in our awareness-raising efforts, because the men have to be by the side of their wives to see them through this very difficult process. I came across a man who was blind in Bida, who traveled 4 hours every day to come and see his wife while she was in hospital. And I think that's very, very remarkable.
That's really commendable.
Yes.
Really commendable. But now, as it is now, a lady who is young can have a baby, right? But she just needs to go through a section or something like that. Or are you saying that she shouldn't have a baby? Do you advise the husbands, please don't have a baby now? Or you tell him, have a baby, but please come to the hospital? But before you answer that, let's take this call. Oh, somebody is calling from Rwanda. Hello. Hello, can you hear me? No, I guess not. So let's go on to that question.
Okay, so from the get-go, I suppose we have to say we're at all not advocates for teenage pregnancy. I'd like to see people getting pregnant only when they're ripe for that, after they're 18. A young lady who presents with, who is pregnant should have antenatal care. Antenatal care has a purpose. You can from that know if the person has potential to have obstructed labor. And if the person has potential to have obstructed labor, you know that a cesarean section would be the answer to that. But don't forget that in our country, there are many places where people have both religious and traditional reasons why they don't want to have cesarean sections. A woman who knows that a cesarean section can stop her from having a fistula will go for one. That's why our awareness raising programs are very important.
So do you go to churches and, you know, to let people know that it's okay